So just to introduce ourselves, since it's only our second meeting, I'm Jenny Minch from Appalachian State University. I've been using Tableau for, oh gosh, 7-8 years now, and had always wanted to start a user group or at least belong to a user group. But you know, where I lived, I just never had enough people who use Tableau to really jump in and do it. Until I met Stephanie, was it earlier this year, late last year?
I don't know anymore. COVID has totally
Yeah,
changed my perspective of time. So,
absolutely. So she moved here from Indiana and had co-run a Tableau user group up there. So we decided, let's do this. Let's make it happen. Oh, and there's Heath, who does.
yes.
So I guess without further ado, I'm not going to waste a lot of time on introductions. I'm going to let Stephanie jump right into the fun stuff. She's going to be talking about some of the features in the newer versions of Tableau.
Okay, thanks, Jenny. So just a quick introduction of myself. Like Jenny said, I just moved to North Carolina a little over a year ago, working for Samaritan's Purse. And I've been using Tableau for several years. I just love the software. I love it because it combines your analytical side with your creative side of your brain and kind of mushes it all together. And I just really love that. And so I've always been a big fan of Tableau. What I'm going to do today is I'm going to give everybody a little bit of a taste of some of the new features in Tableau 2020. And I'm going to go by version 0.1, 0.2, and 0.3. And it's just going to be really short snippets. I'm actually going to show you how some of these things work. So it's not just going to be me talking. You're going to actually see my, my screen as I'm working on this. Because I'm moving quickly, I don't think you should follow along. What I will do at the end of my presentation is that I will upload all of my files to my public Tableau page. So you can go there and you can download them. You'll have the data you can work with as well. So you can kind of see what I've done. Needless to say, I can't go over all of the updates in Tableau 2020 because it would take days because there's just so many. So I'm just doing 6. So I'm doing 3 in 0.1, 2 in 0.2, and 1 in 0.3. So I'm just going to go ahead and share my screen and just get started here. The first thing in Tableau 2020.1 that I'm going to show is dynamic parameters. So what dynamic parameters are, it's just, everybody kind of knows parameters. You can set a parameter to make your workbooks and dashboards more interactive. But what a dynamic parameter does is it will update the values in your parameter every time your workbook is open. So, for example, in this case, I have a bunch of sales dates all the way from January 1st to March 31st. And my parameter is just set like this. Let me show you. So I have all my, my values added from my spreadsheet using the date field. And you can tell I have January 1st to March 31st. Now, what would happen if the next time I open up my workbook and somebody added some additional values? If I didn't have a dynamic parameter, I would have to go in and redo my parameter. What dynamic parameters does is that it will update it automatically. So if I click when workbook opens and check dates by sales by date, it would automatically update these fields. So let me go ahead. I've made that change and click OK. Now I'm going to have to close this workbook down, and then I'm going to have to go into my data set, which I will go ahead and I will show you that as well. And let me find it here. Bear with me. Okay, this is my data set. You can see I have all the dates that I had in my Tableau workbook. Now let's say somebody goes in now and adds these numbers for the month of April. I'm going to save this and then go back to my workbook. And open. And hopefully this has worked. You can now see I have all my April dates in my date parameter. Okay. As I go along, if you have questions, go ahead and put them in the Q&A, and Ginny will gather them all up. And then when I'm done with the whole presentation, then we can go over any questions you might have. Okay, the next one I'm going to work on and show you is animations. Now, animations was a really highly anticipated rollout. And Tableau actually always did something that was kind of like animation, but not really. I don't know if you've ever used Pages before, but if you put a dimension in Pages and then click the Run button, you would get some sort of animation, but it's really herky-jerky. It's not smooth. With animation, what happens is that when you filter or you sort, your movement is very smooth, very flowing. So it's a very pleasant sort of experience. So an animation is really super easy. All you have to do is actually go up to Format and then click Animations. And you get your little animation panel. And all you have to do is click On. That's it. And that's how simple it is. You can adjust the duration if you want, from fast all the way to very slow. You can also change the style from simultaneous to sequential. Since this is so easy, I'm going to show you something that's kind of cool with bar charts. I think it's called racing bar charts, where, let's say, I have two countries here. By the way, this is a Tableau data set called World Indicators, and I'm just looking at the top countries with highest population. But let's say in 1 year, Nigeria and Pakistan switch spots, or Pakistan and Russia switch spots. If I just run the animation right now, you're not going to see that change at all. They're all going to stay in the same order. If I do some sort of ranking, then you will be able to see the actual countries change spots. So let me just show you what this looks like. To do this, you need a calculated field. And I'm just going to call it rank. And it's rank unique that you need. And then I'm just going to use my sum of population total. So that's it right there. Really simple calculation. I'm going to click OK. Now, to get this to work, it can't be continuous. It has to be discrete. So I'm going to convert this pill to discrete. So now it's a blue pill. It's not a green pill. And then I am going to put this up on my rows. And then I'm going to adjust the table calculation just a little bit and have it calculate by country region. And then I'm going to move my country region off of here down to label. So now you can see I just have the ranking here, and then I have the label as my country. So now that I have my animation set and I have my ranking set, I'm going to show you this cool animation. So hold on, and let me start from the beginning here. So you already see some of the animation with how smooth it is moving and also how the different countries are changing spots in the ranking. This is called, I think it's racing. Yeah, racing bar charts. So very, very cool. Personally, I haven't used this, but it's very cool. And if you find in some way that you could use this, I would highly recommend it. And it's very fun to do as well. So my next one that I'm going to show you, we're still in 2020.1, is buffer calculations. And this is another really fun one to do. So what buffer calculations do is it shows you the distance around a point. So here is my workbook, and this is just Airbnb listings from Asheville. And let's say I am thinking of starting up my own Airbnb, and I want to focus in the Biltmore area because that's my favorite area of Asheville. That's where I would like to have an Airbnb. But I want to make sure that I'm not going to be where there's a huge cluster of other Airbnbs, like up in here where they're all clustered around in here. I want to make sure that I'm at least so many feet away from another Airbnb. So to do the buffer, you actually need two calculations. You need a make point calculation and a buffer calculation. So let me start off with make point. Make point. And it is just called make point. And you need your latitude and your longitude. And fortunately, my data set has latitude and longitude already, so I can just use those. And that's it. That's the first calculation you need. Now you need to make your buffer calculation off of your make point calculation. So I'm going to create a calculated field based on make point. And this I'll call buffer. And this is actually what's going to put the diameter around your point. So it's buffer, make point, and here is where you put in your measurement. So I'm going to just start off with 500 feet. So this is going to put an area of 500 feet around the point of each Airbnb location. And you can use feet, you can use miles, you can use meters, kilometers. There's a variety of distances that you can use. So I'm going to click on OK. Now I'm going to make this easier for you guys to see. I'm going to actually do a dual axis map. So I'm going to copy my latitude and move it to the right of my first latitude. So I have two maps here essentially. And I'll make a dual axis out of this. But for right now, my first one is going to be my points. And my second latitude is going to be where I put my buffer. So I'm just going to replace the ID that I have there with buffer. And it's kind of hard to see. Let me see if I can make this work. Let me try a different color here. Okay, let me do the dual axis and see how this looks. Okay, it doesn't look like much right now, so let me zoom in here. There, now you can see. You see the little dots, those are my points, and then the little transparent circles around, those are my distances. So, so that's a buffer calculation. And so if I'm a person looking to open up an Airbnb, I would probably want to avoid this area, or maybe this area. I probably want to focus around here. Now with buffers, you can also, like if you want to compare restaurants within so many feet of your Airbnb, you can add in another another data source, and you can do that as well. So it's very flexible. All right, let me move on to 2020.2, and we're going to go into relationships. And I'm not going to get really deep into this, mainly because there's a lot to it. But I'm just going to try to explain relationships in the way that I understand them. And relationships to me is just a way, it's a little more similar to relational database design, if you're familiar with that. But even more simply put, it's a way to just join, and it's not actually called join, but it's a way to connect different tables. So if you have a bunch of tables with different data that all link together, you would use relationships for that, and it makes it really easy. So this is my data set right here. I have 5 tables. I have customer, transaction, transaction detail, product, and category. I'm going to show you the diagram of all these to try to make it, try to get you to understand how this data is all related. So I have customers who have transactions, and a customer can have many transactions. I also have categories that have many products, and a transaction can have many products. So I have to have a join table in between called transaction details. So, I'll show you in Tableau how this all, I basically will be replicating this model in Tableau. So let me open up the Tableau workbook. Okay, I'm already connected to my convenience store data set, and here are all my tables down here. Now, when you start adding these tables, it's a good idea to drag over the table that has the most granularity, so the most detailed. So that would be transaction detail. So just drag and drop. Now, I'll introduce you to the concept of noodles. So for transaction detail, I know transaction connects with transaction detail. And as I pull it over, you see that little orange, what's called a noodle. And this is going to, Tableau is smart enough, it knows to look for an ID that matches between the 2 tables. So in this case, it's transaction ID. So it's already done all that work for me. Now I'm going to have to do just a little bit more work, but for the time being, I'm not going to worry about it. This looks good. I'm going to go ahead and put in my other tables. So I'm also going to need product. And again, Tableau knows product ID and transaction detail matches product ID and product. And I will do the same with category. That goes with product. Category ID matches category ID in both tables. And then customer. Customer ID matches customer ID. Now, if you ever, like if I put this in the wrong spot, my customer, and I needed to move it, you can simply go to move to, and I can move it to another table. You can also rename your tables. Right now, these are all okay. The only other thing that you should know is that when you hover over your noodle, it's going to tell you the cardinality. Now, cardinality is just, it's a fancy term for how many in one table matches how many in the other table. So in this instance, customer to transaction. Well, I know a customer can have many transactions, but a transaction generally does not have more than one customer. So this cardinality of many to many is incorrect. So I'm going to change that. And to change that, you go down to performance options. And so this is my transaction table. So I know that's many is right, but for customer, it's just 1. So I have, this is now the correct cardinality. I have 1 customer for many transactions. And now when I hover over, I know my cardinality is correct. Now I could do this with all of them, but I'm not going to save time. Just so you know, that it is important to kind of keep an eye on that cardinality because it could change your results of your data. One more thing I want to show you before I move on is with relationships. Now you have all these tables all separated on your data pane, and you also have your measures and your dimensions all separated by the little line. Then if you make any calculations that affect more than one table, for example, maybe I do something with category and product, it's not going to show, your calculation is not going to show up in one of those two, it's going to show up right in the bottom. So this takes some getting used to. We've been using 2020.2 for a while now, and it gets kind of confusing. Your search box is very helpful in this case. So if I want to search for product ID, I know I can either pull the product ID from product or transaction detail. Okay, moving right along. Let's go to set controls. Again, this is in 2020.2. Set control. Okay, so what a set control does is that it allows you to dynamically change the members of a set. So right now I have, I just have the global superstore data. I have my states, I have my sum of sales. Let's say I want to make a set of states. So I'm just going to right click and create set. And I'm just going to leave it to say state set, and I'm just going to pick just a few random ones right now. And then click OK. Now, the state set will work as a filter now, but I can't just add it. I just can't drag it over here and have it work. I actually have to put it on the filter. So I'm going to put the filter on. So now I see all of my states that I put in the set. Now I do want to show my set, and then it pops up here. So now anybody who's using this workbook can just add in as many as they want to their set, remove whatever they want, and your view updates automatically. So that's a really nice interactive feature. So that is set controls. And now let's move on to 2020.3 with the in operator. Now what the in operator is just a nice shortcut if you have to use multiple or clauses. If you've done programming in the past, most programming language has some version of in their language. Tableau has not up until this point. So I'm going to show you a couple of examples of how you can shorten up your calculations using the in operator. So you can use it in if-then statements, and you can use it in case statements. So let's start with the if-then statements. Right now I have a dimension called tri-state comparison, which is a calculation that I built using or statements. So if state is equal to Indiana, or state equals to Illinois, or state equals to Kentucky, then it's tri-state, else it's non-tri-state. So you know, if you've done this before, this can be really time consuming if you have to list a whole bunch of states or a whole bunch of dimensions. So I'm going to show you how to tighten this up a little bit with an in calculation. So I'm just going to go and create calculated field called tri-state comparison in. And this is going to be, I'm still going to use an if-then statement. So if state, and here's where the in comes in, IN. opening parentheses, and then Indiana, Illinois, Kentucky. Then tri-state, else, tri-state, and. Okay, now I'm just going to replace my current tri-state comparison with my new one using my in operator. And you should see no change. Yep, no change. It's the same. So that's much easier to type out. Now let me show you, you can also use it in a case statement. So in this instance, I have a region comparison. And let me show you that case statement. So this is a long one here, a little bit longer. Case state, when Indiana, then tri-state, when Illinois, then tri-state, when Kentucky, then tri-state, when Maine, Northwest, blah, blah, blah. Lots of different operators here. So I'm gonna make this a little cleaner, a little more efficient by using the in statement. So I'm gonna create my new field and call it region comparison in. Use my case, state, when, in, and put in my values. And then my next one, Northwest, let's do Maine, Connecticut, and Delaware. And Northwest. And then when, finally, in, and let's see, I want to do the Southwest, so let's do Arizona, New Mexico, and Texas. And Southwest. And. Okay, it's a little cleaner. Let's just make sure that it's correct, and hopefully I got my states correct in this. I'm just going to replace my current region comparison with my new one. And am I, yep, it is the same. Okay, so that is it. Let me stop my share for now. And Jenny, are there any questions?
There is one question. Like to know how you feel about the removal of the number of records field in the data pane.
I don't like it. Yeah, I had gotten used to using that. So it is a little bit of an adjustment, but you know, you adapt. We've been using relationships 20.2 for a while and relationships for a while, and you get used to it. But no, I don't like it. I liked the old version of that.
I have to say, I have some old workbooks that still rely on that, and I yeah, have to go in and make sure that they are still joined, since you can still do joins in the,
Yes.
the new version.
Mm-hmm.
I, for one, love the in calculation that you were just showing. I was very disappointed that it can't be used for and statements, only for or statements.
Yeah, it's only for or.
Yes.
Yeah.
Does anybody else have questions for Stephanie? You can put those in the Q&A box.
Let me go ahead. I'll share my the URL to my public Tableau page. And I don't have the workbooks up there yet, but I will by this evening. So feel free to go back there tomorrow and and you can download anything you want.
Great. If anyone else wants to share their Tableau public links, I mean, I'm sure we'd all like to follow each other and see what everyone's doing, what everyone's working on. I'll put mine in there in just a minute when I have a chance to look it up.
Great.
Yeah.
Okay.
Well, aren't more questions for Stephanie. If Cody's ready, we can do that.
All right. So can everyone hear me okay?
Yes, I can.
All right. Let me get the share screen started. And can everyone see my screen?
If it says, "Are you a data dreamer?"
All right. Well, thank you. Thank you, Jeannie and Stephanie, for asking me to present today. When Jeannie emailed me and asked if I would like to present, my first and quick response was no, because I am probably the least likely Tableau presenter in a tug that you've ever seen. And we'll talk about why that is as we go. But after a day of thinking about it and thinking about what I could do, I emailed back and said, hey, I would like to take this opportunity. Even though this is not going to be a how-to session, and most of your Tableau tug meetings tend to be how-tos, I still feel like I could add some value and kind of go over where I come from in the Tableau world within my organization. So I'm a data dreamer, and this is how I try to bring Tableau to my organization. So I'm going to start out by talking about who I am not before I talk about who I am. So I am definitely not any of these guys, and I'm definitely not a Tableau Zen master. Would love to be one day, but circumstances keep me from really being able to dive in and do some of the technical training in Tableau. But someday I'll get that chance. But for right now, I'm definitely not a person who has ever created any kind of complex dashboards or worksheets, but I have worked in Tableau from a very basic level. And I've also introduced Tableau to a lot of people in my organizations. And that's kind of where we'll be talking about where I think I can add value and where maybe you can add value to your organization. So yeah, I'm not these guys, I'm more these guys. So I am the dreamer, but more specifically, I am the Chief Financial Officer for Western North Carolina Community Health Services in Asheville. And one of the reasons I kind of came back to Jeannie and said I would like to present is I want to introduce anyone who's watching this to that kind of golden nugget of an industry that not a lot of people know about, but it's a very crucial industry in the healthcare world that I just want to kind of introduce people to as part of this talk. I'm a lifelong learner, and that's one reason that I've kind of taken up Tableau later in my career. And I think you can always learn and you can always adapt. And this is a constantly changing world where being an anxious learner and someone who's always attuned to what's going on can be beneficial. I am an accountant by training, so I would call myself a planner. I'm one of these people who, when I start out on a vacation trip, I've got all my stop points planned out on the map. I, have my itinerary set for the whole week I'm gone. And that's kind of the way I've approached bringing Tableau to the organizations that I have worked within. And lastly, I'm an educator, foremost because both of my parents are educators. So I've been around education all my life. I did teach for a short period of time. And that's another tool that I have in my skill set that I was able to bring to the organizations. So a little bit about my Tableau journey. So as I said, I worked my career in public accounting. So a lot of audit work, tax work. So I was very familiar with spreadsheets, tables, financial statements, those things that accountants deal with on a daily basis. Spreadsheets, I go all the way back to the Lotus 1, 2, 3 days. So some of the young people on the session today may not even know what that is, but that's how long I've been working with spreadsheets. That's a very comfortable world for me. But when I transitioned from public accounting to becoming a CFO, or Chief Financial Officer, back in 2013, one of the first things that I had to deal with was, we are nonprofit organizations, and I'll talk a little bit more in a second about community health centers, but you are typically a nonprofit. You could be a governmental unit, but your board of directors has to be 51%, made up 51% of the consumers of your health center. So that means 51% of our board members come to a board probably for the first time and really have no financial background or training. So this is where I had to learn to try to educate them about what financial statements look like, how do you read financial statements, and you really quickly see them, like a lot of people, you just see their eyes glaze over as they start dealing and digging into numbers and just seeing tables. So very quickly, I knew there needed to be a different way that I could present this information. And back in 2013, oh, and by the way, you see three little logos at the bottom. I was thinking about this. Is it taboo to have Tableau on with its competitors? Who cares? Anyway, so when I started digging into, what are some platforms that I might be able to do some kind of data or visual tools to teach my board about the financial statements, at that time, Domo was really putting a lot of money in advertising, and it popped up, and I thought, oh, that's really interesting. I could see how you could use that. Started digging around, found that these three were sort of foremost out there, even though this was sort of early in the game. But it did not take me long to realize that Tableau, the strength of Tableau was its flexibility, how it can connect to all kinds of platforms, all kinds of data. But foremost to that was the fact that the community was already starting to be established, and there was always people you could reach out to, and that has just grown exponentially over the last 6 years, 7 years. So it was quick, a pretty quick decision for me to start looking at Tableau, and I started dabbling in it, and then went between 2 or 3 different health centers. So each step that I've gone into a new health center, I've tried to bring Tableau as a possible tool that we can use to look at our data. And at that point, I just began trying to read and consume any kind of information I could find as it related to Tableau, how to create Tableau dashboards. I guess the one thing that I'll throw out is one of the reasons I don't have that real technical side of it at this point is I have a lifestyle. I have a handicapped child who occupies quite a bit of my time outside of my working hours. So I don't have that free time that I can just sit down and really try to learn it, even though I'm working through e-learning, the Tableau e-learning tools now. But I still felt like there are people I can bring together in my organization, introduce them to Tableau, and we can build something great from that. So that's kind of how I came across Tableau and how I started digging into how we might be able to utilize that. So as I said, I wanted just kind of brief introduction to people who don't know what community health centers are. Sometimes you hear them called federally qualified health centers. So we are a full service medical, a healthcare facility. We offer medical, dental services, behavioral health services, substance use abuse services. We have a full-blown pharmacy to provide discount drugs to our patients. We in Asheville at the Western North Carolina Community Health Services, we call it WNCHS. We are a Ryan White HIV program here in Western North Carolina. We are the primary agency for the 18 counties of Western North Carolina. Oh, by the way, I am a native of Western North Carolina. If you can't tell from the accent and the dialect, it won't take long to figure that out. So what is kind of different and unique is we are funded by the federal government to a small degree. And that money that we receive from the federal government is to allow us to be able to see patients who are low income, uninsured or underinsured, don't have the means to pay for a full cost of medical care. And we know that grows just tremendously by the day. So we're subsidized by the federal government, and that's where we get that federally qualified health center designation. We do receive state funding, and we do receive private grants. And in North Carolina, I think at this time there's about 22, 23 community health centers across the state. They are national. They're national. A lot of people just don't know what we do. you can see we're full service. And it's not that we just serve the low income. We serve any patient. Matter of fact, I think we get the stigma that we're the place for, I think one of our patients said, we see the little people. And sometimes I think that people equate the fact that we're seeing low income people or patients that we may not have the most highly trained physicians. And I can say in the 8.5 years that I've been in this industry, I've worked with doctors who have degrees from Yale, from Emory, some of the top medical schools in the country. And it's not that these low income people are being forced to see providers who are not educated or not as talented as some of the other physicians that work in private practice or in a hospital setting. These are top-notch physicians, behavioral health specialists, dentists, and our services are open to all. So, we have open arms. We see any patient who wants to participate. We just have a passion and a heart and a mission to see those low-income people. So, where does Tableau fit into this? Well, as you can imagine, being federally funded, we have to report everything to the federal government to prove that the money they give us is being used effectively and efficiently. So we are constantly having to feed them data, whether it's whether it's data that we're pulling out of our electronic health records, whether it's counting finance information, whether it's our finance software that's dealing with claims and revenues, tons of spreadsheets. I mean, when I walked into Winchester over a year ago now, the secret that I had to learn was who has what spreadsheet, who's got the key to unlock that particular spreadsheet. And it wasn't a very effective setup or an efficient way to find that out. So we're just pulling data from all over the place. And that's one of the beauties of Tableau is that you can connect it to so many varied sources and bring all that data into one background where you can start working with that data and not have to try to pull it all to a certain spreadsheet and then work with it. Not only that, the data is coming from a lot of places, but there's a lot of different components within the organization. There's obviously financial, which is my department, but you've got your operational, front-end operations, front desk staff who see patients from the time they walk in. They take their insurance cards, they get all the demographics information, they help them, they calculate the sliding fee discounts that each person's is subject to based on their income levels. So you got all these operational workflows that are going on, clinical and quality. If I go to a physician, I want to know that I'm going to get quality care. And with a community health center, we really have to report quality. Western North Carolina Health Services, we just won our second year in a row. We've won what's called the Gold Award for being a top 10 community health center in the United States from quality. And we have about 17 different measures they look at, from weight loss to vaccination history, all types of quality measures that we have to answer for every year. There's the administrative piece of it. There's the human resources piece. So you can see there's a lot of different people working with a lot of different data coming from a lot of different directions. So that was the quick introduction to a community health center world. So if you live in a community, find out where your community health center is. And, I would ask you to get to know about them, maybe look at being a patient, look at being a board member, seeing what you can do to help in the community, because it's a really great community and it's a passion that I've developed in the 8 years. And I can see how I'm helping patients even though I'm still in the accounting department. So what is my vision? What vision do I bring to my organization as a Tableau visionary? I will say this, and I think this is very important in the Tableau world because it's such an open community. There is nothing that I'm doing that hasn't already been done. I am imitating, stealing from a lot of different people to try to bring Tableau to my organization. And I think it's important when you're borrowing or when you're working with data from another person or working from a workbook or a worksheet that's been created by someone else, always give them credit. And as I go through this, the remainder of this, I'll throw out some names of people that I kind of look up to in the Tableau world and have modeled a lot of the work that I've done, because I think it's important for for them to get the credit that's due them, but it's also a way, it's some names of people you might want to look up on Tableau Public or look up in various places that we'll talk about as someone that you might can see what they're doing, and it might benefit you and your organization. So just kind of 4 things that I try to bring into the organization that we can start looking at how we can utilize Tableau as a data analytics tool. So the first thing that we try to do is create what we just call the Tableau Champions team. It's that internal group of people. It's sort of like a center of excellence, but they're the people who are going to be your primary drivers in the organization, who are content creators, who are the people that you can rely on, that you build that initial implementation out with, and they're the ones that help you push that implementation. Secondly, we want to provide as much education for these people when it comes to Tableau, whether it's purchasing e-learning for them, creating a library, things we'll look at here in a second. Thirdly, I think it's important that you create a consistent look within your content once you roll it out into the organization. And we'll talk about where I think that's important. Some people, you can look at their work. And last, and this is again the strength of Tableau, is not only can you take your champions team, you can build a network of other people, other constituents in the community, in the Tableau world, in similar industries, who can really push you forward and help your organization get to where it wants to be. So I just want to take a quick time, and I do have some spreadsheets, some Tableau work that we've done in some of the health centers. Some of it's fairly basic, but just some things that we have created in a short span of time that we're starting to try to utilize. And so you don't just see PowerPoint slides, you're going to see a few dashboards here. So that champions team, whoops, wrong way. That champions team, so that the purpose, as I said, is that core unit in the organization that's going to drive everything that's being done. And a lot of this was built off of some blogs and some writing from Simon Beaumont, who I think is in the Iron Viz competition at the Tableau conference this year. Simon is one of the people I've always kind of looked at too, has tremendous work, and he brought a lot of this information in some of his writings. So I just wanted to give him that credit. So you want to bring members into this group that are bought in, people that are committed. Like I say, in my organization of about 190 employees, there's maybe at most 5 people that if I use the word Tableau, even know what I'm talking about. But there are 5 who are really interested in Tableau and really interested in learning about data and how you take data and mold it and create data analytics, and how you create storytelling from that. So that's that core of people that you get them in a room together for a meeting once a week or once every other week. They're going to do whatever it takes to learn and to grow and to be to be what you need in this particular group. We want to make sure we're getting them all the training they need. Tableau, for the most part, is a relatively inexpensive product for the value that it's bringing. So spending $120 on an e-learning session for a 1-year session that they can learn, that's a no-brainer to me as a finance person. These are the people, as I said, who are going to be developing a lot of the content starting out, and then hopefully, as you can see, point 4, they are the people who do the lunch and learns. They're the people who sort of are your Tableau doctors in your organization. So we started out having just a lunch period where people can come in, bring their laptops and say, hey, I'm trying to work on this dashboard. What am I doing wrong, or what can I do better? So this is that core group that becomes the trainers. They're the teachers. They're learning now, but eventually they're going to be the trainers. So we're just training trainers at this point. So that's that value that you get from the Tableau Champions team. What kind of training plan do we offer these people? So every learning, you want to provide every learning opportunity. The e-learning, to me, there's the data analytics, and there's just storytelling in general. So it's really 2 things. It's being able to create the graphs, but what does that graph and story tell you? And I really love the work of Cole Nussbaumer with storytelling with data and everything she's done with that. That's someone you might look at her books. I'm a big Twitter user. And one of the if there's anything that's good that's come out of the COVID crisis, in my opinion, it's been the fact that Tableau has put all of these virtual user groups out on YouTube. I spend way too much time in my car driving and watching the Tableau user groups. We've got some great groups in North Carolina. Charlotte just met last week. I know Rashid Manat and William Aubrey from that group were on the call today. You've got the group in Raleigh. You had Mike on in our first ever High Country. That group's doing great work, and I know Triad area has one. So I think it's Bonnie McLean is the leader there. So you've got the tons of YouTube. You can do tons of training. There's all kinds of great trainers out there. You've got the Udemy courses that you can sign up for, which are really inexpensive. I've gone through a few of those, probably not invested $50 in different Tableau trainings. Mark Conley's got a great one for healthcare right now. Matt Francis, he's probably the first one that I ever started watching some of his trainings on Udemy. And Kirill Eremenko has an extensive series from anywhere from basic to advanced Tableau. So those are great courses. Read any blogs you can find. Blogs, I use Feedly as an app where it's an RSS aggregator where anyone who's blogging about Tableau, I add them to that Feedly, and every day I go in there and say, hey, is there anything good that anyone's writing in here today? You'll learn so much just from the reading, just from, you learn a lot from doing, you learn mostly from doing, but when you don't have the time to do, you can still find time to read, even if it's that 10 minutes before you go to sleep. So I pick up a lot just from reading the blogs and watching the video, the blogs. Build yourself a library. Build a library for this organization. So on my shelf in my office, everyone knows there's a little corner on the top shelf. That's the Tableau library. I've put my own personal books up there. Probably have about 10 books at this point that deal, with specific to Tableau and how to versus storytelling with data. So you can start building that out and make that an organizational library that everyone has access to. Tableau Public. Stephanie just gave us her link to her Tableau Public page. Tableau Public's a great way to learn, and it's free. Go out there, join, start looking at the work everyone's doing. And then lastly, another way to learn is just to participate in all the makeover programs that are out there. You've got Makeover Monday. You've got Workout Wednesdays. You've got Public Health Viz. There's so many now. Storytelling with Data Challenge. So there's a lot of different makeover programs where the data is provided for you. Pop it on Tableau, start building something out. It doesn't have to be great, and that's getting over that fear that my work is not going to look as good as someone who's been doing this for 15 years. Is something I still battle. It's one of the reasons I instantly said no. I'm not going to present in this Tableau user group just because of that fear. But I wanted to overcome my fear and try to really commit myself to getting the training I need. Develop a look. Once you've got your Tableau team in place, once you have started educating them, start thinking about how you want to build out your organization's dashboards. What are those going to look like? And I think it's very important that you create a consistent look so that anyone who's accessing these dashboards can instantly know, hey, I'm looking at this dashboard and it has this that tells me it's part of this division of the organization, or it's this type of dashboard. That's a lot of what I've picked up from my readings when it comes to style guides. Simon Beaumont, again, I pointed him out earlier, when he was with National Health Service Corps in UK, they had a great style guide that we kind of looked and modeled some of our work after. John Schwabish has a link on the Urban Institute where he's just got tons of different style guides by different organizations. And you can always tie that back to your organizational branding. If you've got a color scheme that's part of your organizational branding, build that into your dashboards. One of the things we start doing is we have made a color for each dashboard that we're trying to build out. So everyone, if a dashboard comes up and it's green, they know that's finance department. Green money, we kind of said that. If we've got a sort of a pink color or a really light red color, that's our clinical area. I think of blood, heart, medical, that's the red color. So people can instantly open it up. They know what kind of dashboard it is that they're looking at. Also, dashboards don't have to be super complex. They should be pretty minimal, pretty clean. Otherwise, they become something that people just can't understand, and it just becomes overwhelming. So that's one of the things we're trying to really work on, is not overwhelm the consumer with tons of data. Just, give them something clean, something they can understand, and you can build off of that. I'm not going to talk much, but we're kind of in that size where we're having to evaluate, do we go with Tableau Server or do we start using Tableau Online? I think that's something that you can consider, and your champions team can kind of discuss that and build that out. And then lastly, one of the things we really want to do is create some alerts for these dashboards, so that when certain things are happening in our organization, we get alerted via email. The first thing in the morning says, hey, the numbers are showing this. Just go check your dashboard, see what's going on. So just little things that we're trying to get some consistent look throughout the organization and the dashboards that we're building. And then finally, the best way to learn and to grow is just what we're doing now. Get together with people that are like-minded and want to learn, and people who can help you. So I really say develop those go-to people that you can reach out to. And that's the beauty of this of Tableau itself, is just there's so many people. Sometimes it's, where can I find key members of my industry? When I first introduced Tableau to an organization, I knew Jonathan Drummy, who's been a Tableau Zoom master many times over, had worked in healthcare and still does in a different capacity now, but he'd worked in a hospital setting. So I just shot him an email and said, hey, is there any way you could do a little 15, 20-minute presentation of what Tableau can do for a healthcare organization? And he was just very gracious, hopped on, did a little training just to show sort of my CEO. And that's who I was focusing for. I was like, I want to sell my CEO on the benefits of Tableau. She had never seen it. After that, we were able to get 3 or 4 licenses, get up and going, and start training some people, because she saw what Jonathan was able to do with that. Find other companies that are using Tableau in your industry. As I said, in the healthcare industry, and when I'm saying healthcare, for me, community health center, large hospitals have a lot of data analysts, and Tableau is becoming more common. But see if there's other health centers, particularly, or any other organization in your industry that are using it, so that you can find someone in there and you say, hey, we're looking at implementing Tableau. How did you go about it? What are you doing with it? I've had sessions with maybe 2 or 3 other health centers across the United States that are starting to dip their toes into that Tableau water and doing some great things just right out of the box. So make those contacts. Everyone's willing to help. There's very few people going to say, no, I don't want to show you what we're doing. Thirdly, you've always got consultants that are on a contract basis that make their living. We utilize the company out of Raleigh, Isimo. They just got bought out by Cherry Becker, so some of you have probably worked with them in the past. Bryce Gartner and his team, tremendous, did a great job of training our organization about getting off the ground with Tableau. And then last, attend Tableau conference. I've never got to go. I paid one time and then had the federal government say, nope, we're coming the same week to audit your organization. So I didn't get to go. The beauty of this year, and I think Jeannie's going to talk about this in a little bit, is Tableau conference is coming up and everyone's going to have the chance to participate. And really take advantage of your Tableau user groups. When I was working in the Charlotte area, I went to a couple times to the Charlotte group, met William and Jeremy and Rashid, all those guys. Just kind of learned just from being around them. I wasn't very active, but take advantage of those user groups. And if you're ever visiting a city, you probably can find a group that you could go and have a great meeting and get to meet some more great Tableau users. So those are sort of the where I feel like I've brought some value to my organization, is to create the vision for what Tableau can do. Kind of be that person that pushes it along. I'm not the data analyst. I'm comfortable working with numbers. I'm comfortable working with data. I know how to pull data from different sources, but I'm not that person that's just going to be able to sit down and create elaborate dashboards at this point in my career. I hope to at some point. But let me just kind of show you real quick a few just basic dashboards that we've built out in our organizations. I will give credit, again, I think that's important, to a gentleman named William Thompson. Will was my staff accountant at the previous health center I was at, and he was he was one of those guys that really bought in. He saw Tableau as a staff accountant and said, yeah, we can do this. And he, in a very short period of time, learned Tableau and did some of the interesting work that you'll see here. Some of it, as I said, we were pretty basic, and that's the way you start learning, is just do something small. We took some of the spreadsheets that we were already doing in dashboard form and started trying to convert those to Tableau, because the goal was that I went to a training when I first started as CFO, and they were saying, how often do you present your financial statements to your board of directors? And most of us have monthly meetings, some quarterly, but even when you've got a monthly meeting, you are usually doing the presentation later in the following month. So at that point, the data has almost gotten to be 2 months old. And the question was, how does the federal government look at how you're telling your board about data that's 2 months old? So from that, I was like, it really is. We need to become more real time and hands-on with our data and understand, because if I'm looking at why did our visits start dropping 2 months ago, I'm really already behind the 8 ball. So that was one of the reasons I started looking for dashboards. I wanted to find a way that I could create something that gave me real-time, actionable data that, I could be more proactive and not reactive. And, when I presented this and I talked to health centers in all of North Carolina, we have a network that we meet quarterly. And believe me, they hear Tableau from me all the time, and some of them have started getting excited about the possibility. But when I start talking about being proactive with my financial numbers and how, I'm wanting to project out 2 or 3 months to 2 or 3 years ahead, I don't want to be reacting to something that happened 2 months ago. That kind of catches their ear. So just like I said, these are some very, very basic dashboards and worksheets that we've created. So this is just looking at a historical trend of visits by patients based on their insurance source. So, Medicare, Medicaid, private insurance, or self-pay, just so we can get a trend. And we would sit down with these as a management team. We sit down with these weekly, and we start saying, hey, what's happening here when we're seeing a dip? So just simple line graphs. This is another way of looking at visits by location. So, this particular health center has 4 locations here in North Carolina. And, we start asking those questions. For example, where are the dips happening? Are we down a provider because we had a doctor leave and go somewhere else? What can we do to improve? For example, if you look at the orange line here, or excuse me, the green line, that was a new health center that started late around the time this graph starts in March of 2017. And by the time I left late last year, they had already moved up into the 2nd position here as far as the number of patients or number of visits they were seeing in a monthly period. So this one's pretty busy. I'll tell you what this is. And somebody may say, hey, I know a better way of doing this. So this is just, we have to develop a strategic plan every 3 years, present this to the federal government, say, here's the things we plan on working on. So we went through the plan, and we were like, let's put this on a calendar. How can, we need to be able to see this. So Will and I kind of sat down and said, what about a Gantt chart? Let's get it to where we've got it timelined out. And so we came up with this. Filtered is going to look a little cleaner. So if I look at finance, I just use tooltips here as a way to show what the strategy is, what the start date, end date, and what the action steps we're taking. So like I said, this is really basic. This is sort of us playing around and trying to learn in some very basic and simple, but we're getting a point across to the things that we're wanting to do. And this just kind of let us have a timeline to where we could see, what's the end date and start date for these. So simple Gantt chart. And lastly, this is probably the most elaborate dashboard we came up with. And this particular version is not exactly working because I got an older version of it. But this is just what we call our provider dashboard. And so at the beginning of the year, we tell each physician or medical provider, we expect you to see so many visits during the year. We expect you to meet quality measures. And these are numbers in a lot of places they've never been asked to keep track of that. So what we do is create this dashboard that gives them top left corner just a actual visits versus budgeted visits. Where do you stand? This is a very short period of time, so this is some really basic data. So how are you coding? This is a billing and coding chart, and we built this in because they had just gone through some coding training that said, you should be coding the majority of your visits or this mid-level, not too complex, just a basic office visit for a runny nose versus some complex chronic care cases. And this should be a very bell-curved histogram. And so if we're not seeing that, then we know we need to kind of examine, and the providers went through this training. So I said, when you look at this chart, you're looking for that bell curve. And if you're not seeing it, let's dig into what's going on. And are you really seeing a lot more complex patients than some of the other providers, so that we can impanel you better and more evenly, so you're not the one that's getting slammed with all this difficult work. Diagnostic codes, what type of patient code, what are the conditions you're dealing with? And this is more for the provider to look at it and say, that makes sense. I'm dealing with a lot of diabetes patients. I'm doing a lot of just routine physicals of children. So this is more just an information for them to look at how they're coding, what are the diagnoses they're dealing with, and does it match what they think. And then the bottom one, this was what we call UDS, Uniform Data Set. It's just, this is the federal government's quality measures, clinical quality measures that they set for us every year and say, we expect you to meet a certain percentage goal with all the patients that you're seeing. And like I said, this is not working, but this particular section of the dashboard has all of the quality measures, what the internal organizational goal is, and where this particular physician falls. And then we can change the range around that goal. So this should be doing a red, green, and yellow, which I know for colorblind is not the best in the world, but it would tell us if it's green, and most of the time we would see most of our providers had green, so they were meeting that goal for all their quality measures. But if there was, a yellow one, they knew they were really on that borderline. They needed to make sure they were doing their coding, or that they were doing, the immunizations, because they were not meeting that goal. So they really focused on those yellows and definitely any reds. And this was interesting because we could show this by organization. We could show it, it may not work. Yeah, I think this is a little bit broken, but it gave us a way to say, hey, this provider is low when it comes to cervical cancer screenings, but Dr. X is really high. What's Dr. X doing? Get them in a room together and let's discuss so we can make that happen. So these are the types of dashboards we're trying to build out in our organization. Everything, like I said, financial dashboards, clinical, quality, administrative, HR dashboards. We're trying to cover all the gamuts, but we're just in the early startup phase on it and really excited about what we can do with it. So I appreciate you taking the time to listen to me, give you a not how-to presentation. If you have any questions, I would be glad to take those. If not, I'm going to pass it back to Jenny.
Thank you so much, Cody. If anyone has questions, please go ahead and put those in the Q&A box. I definitely think that you have some comments in the chat box you'll want to check out. So I just wanted to do a quick poll, and I don't see the poll option on here, so you'll just have to put your answer in the chat box. Who is registered for the Tableau conference next week? How many people are planning to go? I'm definitely going. For anyone who is not signed up, it's free and it's virtual. And unless, you are just swamped with meetings all day, every day, you should probably just register and go. They have a lot of on-demand sessions that you can watch anytime that you have a free minute. And so I just put the link in the chat box so that if you're not already signed up, you can go on there and register. And this is what the page looks like. So you'll go onto this link, you'll click register now. From there, it'll have you log in or create an account, and then you'll be able to go and plan your schedule. This was a fun part for me. So this is the schedule that they have posted on their website. It's color coded based on the topic or theme. And keep in mind, mine is showing for Eastern Standard Time. If you're in a different time zone, my guess is it will fit itself to your time zone. And then you can just go hover over any of these different sessions. You can click on the title to read more about it, or you can click to add it to your watch list. Then you can go up here and see your watch list and put it onto your calendar. And that way you don't miss anything. But going back to the main page, there are a lot of different links on here where you can get additional information. The Learn page has a schedule overview. The speakers page has a long list of people that I personally cannot wait to see. I won't scroll all the way through it, it's pretty long. The Connect page gives a lot of information about what you can do, Tableau doctor appointments, brain dates, and if you've never signed up for a brain date, you should definitely go, because these have been some of the most productive networking events that I've ever been to at the Tableau conference. You can meet a lot of interesting people and get so many great ideas. They have a sponsors page, a partners page, and this is really handy, a page of videos that you can watch and just get all the information you need to know about the conference before you go. And because this is the very first virtual Tableau conference, and because it's not like any other Tableau conference has ever been before, I definitely think that we all could use this refresher to make sure we're not missing anything, because we don't want to miss out. So if you haven't signed up, definitely get on it. And does anybody else have any questions before we wrap up our second official High Country Tug meeting? I don't see any. We'll be sending out a survey to everyone afterwards. It's very short. We just want to get your input and some ideas about what you would like to see at our tug meetings in the future, because we want to make sure that this is meeting your needs and that you're getting the most out of it that you possibly can. Stephanie, do you have anything to add?
No.
All right.
Just thank you to everybody for attending.
Yes, definitely. And I guess we'll see you next time. I think next time, well, will probably be a December meeting, and it will probably be another virtual meeting. We might be partnering up with the Carolinas group for our virtual December meeting. So I know some of you
Would be good.
It will be awesome. We were definitely looking forward to it. Thanks all for coming.